Welcome to the Prepped and Polished podcast, the podcast that empowers you to take control of your education. Featuring weekly interviews with influencers in the world of education, as well as tutoring tips, lessons, and updates. And now, here's your host, Alexis Avila.
Welcome back to the Prepped and Polished podcast. This is Alexis Avila, your host. Be sure to join our community. You can find us on Facebook, Twitter, Google+, Instagram, YouTube. If you just type in Prepped and Polished, you'll find us. Also, go to our site, preppedandpolished.com. Sign up for our 1-hour SAT Strategies course, SAT Strategy Secrets. It's on the site. You'll see it. I teach the course. Check it out. Have a question or reaction during or after the podcast? Submit your question to radio@preppedandpolished.com. Today's guest is Ann Helmus. Ann Helmus is founder of NESCA. NESCA is the Neuropsychology and Education Services for Children and Adolescents. Ann Helmus has a PhD and is a licensed clinical neuropsychologist who's been practicing for almost 20 years and specializes in the evaluation of children with learning disabilities, attention and executive function deficits, and primary neurological disorders. In 2007, Dr. Helmus established NESCA, a client and family-centered group of seasoned neuropsychologists and allied staff. Ann received her undergraduate degree in neuroscience from Brown University, earned her doctorate at Boston University School of Medicine. On today's show, Ann talks about the various types of emotional disabilities, why student depression has risen over the years, and offers tips on how to best overcome emotional challenges. Let's get to today's guest. Hi, Ann. Thanks for coming on the Prepped and Polished podcast. How are you today?
I'm doing well, thanks.
Great. Can we start off by you sharing a bit of your background, focus maybe on a few pivotal moments that brings you with us today as a neuropsychologist who specializes in evaluating children with learning disabilities, attention and executive function deficits, and primary neurological disorders?
Sure. My journey sort of started a long time ago when I was in high school, and I had the opportunity to work at a residential school for kids with cerebral palsy, and then the year after that at a day school for kids with autism. And at that point, I was really interested in understanding how the brain works and trying to understand more about the nature of these disorders. And so I went to college, went to Brown University, studied neuroscience at Brown, and was ready to go on to medical school and become a neurologist, and decided that I would take time between college and medical school to actually work in a neurology department and make sure this is what I wanted to do. And so I got a job as a research assistant at Mass General in the pediatric neurology department, and very quickly realized that I was not interested in neurology because it was really focused a lot on children with seizure disorders and just prescribing medication. But I had the opportunity to work with a neuropsychologist who was there in the early 1980s and helped him do research, and was fascinated with the field of neuropsychology, which I had never heard of prior to that. And so I switched gears and decided instead of going to medical school that I would get a PhD in neuropsychology. And so I did that at Boston University, and then did training at Children's Hospital, and ultimately opened my own practice about 18 years ago.
Nice. And can you tell us about your organization, Neuropsychology and Education Services for Children and Adolescents? It's also known as NESCA, and talk about the services you provide.
Yeah, much more easily known as NESCA. But this was in the computer age where I have to have all the keywords in there for people to Google and find us. So NESCA was started in 2007, and prior to that I had been the co-director of another organization that was similar to NESCA. And we're a multidisciplinary practice and provide evaluation and treatment services for children and adolescents ranging in age from about 2 to 26 or so. And we see individuals with a range of disabilities, learning issues, attentional issues, psychiatric or emotional problems, developmental disabilities like autism. And we have about 15 clinicians here and provide an array of services. So in terms of assessment, we do neuropsych assessments, educational testing, assessments of emotional functioning, transition assessments, which are looking at the readiness of high school students, oftentimes with significant disabilities, to make the transition to post-secondary programming. We have a transition services program where, in addition to doing assessments for kids with various kinds of learning issues, we also provide coaching and counseling and community-based coaching for adolescents who have different kinds of learning or developmental challenges that will need extra support to make a transition to a post-secondary setting. We offer psychotherapy, primarily using cognitive behavioral approaches. We're building an integrative treatment program here where we have a acupuncturist that specializes in pediatric acupuncture and works with a lot of individuals who have attentional issues and anxiety disorders. We also have 2 yoga therapists who use mind-body kind of work with students on the autism spectrum and individuals with anxiety, and so they do a lot of breath work, mindfulness, meditation, that type of thing. And then we provide a lot of consultation to schools and to other professionals.
That's amazing. I love how you added the yoga and the acupuncture, just a natural add-on to your services that relates so much to what you do.
Yeah, I think it's sort of in keeping with our philosophy, I think, to try to empower people to do as much as they can to help themselves. And medication is definitely something that is necessary for some of the kids and adolescents that we see here, but we always try and start with, what can you do through therapy, through lifestyle changes, that kind of thing, and then we can always refer on for medication if that's also necessary.
Nice. Taking children through the evaluation and treatment process and adolescents, do parents play a role in this process as well? And how?
Yes. So parents are obviously a critical piece of the puzzle, since they're the ones who are living with kids and are going to be coordinating care and actually and really sort of managing the child's home environment where they spend a lot of time. So typically for the neuropsych evaluation, the parents come in before we ever meet the child and have an intake appointment, and that usually lasts about an hour. And prior to the intake, we will have received questionnaires from the parents and from the teachers so that we have some background information. And that gives us a chance to get to know the parents, understand where they're coming from, what their concerns are, what they observe in different environments with their child. And then during the actual testing, typically parents are not present in the room unless the child is young. So if a child is under the age of 5, then often we will have the parent in the room if that makes the child feel more secure with the testing process. Once we're complete with the testing, then we meet with the parents for an hour-and-a-half feedback meeting. And at that meeting, we'll share our impressions of their child, what we observed, what we found in the testing, how the teacher comments fit into that whole picture, and to try to create a holistic view of the child, of where the strengths and weaknesses are, how do these strengths and weaknesses potentially explain whatever the referral question was, whatever parents are concerned about or teachers are concerned about, and then really working through the recommendations. And the recommendations will include both what we want the school to do and how we're going to get the school to do that, and also what we want the parents to do at home. And sometimes those are parenting techniques, sometimes those are services to bring into their home, quite often tutoring kinds of services or coaching services, whether the child needs psychotherapy or other sorts of interventions. And we typically try to establish a long-term relationship with the families that we work with. And I feel like when we've gone through the whole neuropsych process, where we've collected so much data from parents and from teachers and from the child themselves and invested so many hours to become somewhat of an expert on the child's learning style, that we should leverage that knowledge over time. And as the child is facing new developmental challenges with the passing years, that we can be a really good resource for parents. And indeed, a lot of our parents take advantage of that and will come in regularly for consultation when they're trying to make educational decisions or if things are going wrong or that sort of thing. And we see a lot of our clients for testing at kind of regular intervals, like maybe every 2 years or so, just so that we keep tabs on if they're growing in the areas that we're targeting and so on.
That's fabulous. Now, one category of disorders you evaluate and work with are the emotional disorders. And what are some of the major types of emotional disorders when we say that students struggle with?
Yeah, I think that in our practice, being an outpatient setting, that typically what we see are kids who are struggling with one of the anxiety disorders, which would include not only sort of phobias and fearfulness or excessive worrying, but also obsessive compulsive disorder, perfectionism, those kinds of things. So those would all be under the umbrella of anxiety, and then the other would be mood disorders. And predominantly what we would see for mood disorders would be kids who are struggling with varying levels of depression. We occasionally will see a child who is referred for attentional issues who will turn out to have more of a psychotic sort of presentation that, people weren't aware that they were just checking out because they weren't always staying in touch with reality, but that's pretty rare for our practice. Much more often we're seeing kids who have anxiety or mood issues. And sometimes those are secondary to their learning issues. And since kids spend the majority of their day in school, and that's sort of their job, if they have a learning disability or attentional problems, school can feel really challenging and can, over time, erode kids' self-esteem or cause a lot of anxiety. And so it's one of the things that we're very attuned to with all children who come in here, is if you have some kind of learning issue, developmental disability, have you also developed secondary emotional symptoms as a result of that? And we also see a number of kids where I think the emotional disability is primary, and the reason why they're struggling in school is because anxiety is getting in the way or depressed mood is getting in the way.
So when you have a kid get tested, does the test help elucidate whether the primary is the emotional and secondary is the learning and vice versa? Or
Exactly.
Okay.
And I think that's why it's one of the things that we're looking at when we do a comprehensive neuropsychological evaluation. So the testing is part of it, but I always say we have three major sources of information. We have history, observations, and those are not only our observations, but parental observation, teacher observations, and then we have the actual testing data. And so by being able to carefully analyze and integrate all of that information, we can come up with a profile that makes sense in terms of understanding, okay, well, when did the emotional symptoms start? How do they correspond with what was going on in school? And so on. And,
I mean, you've been doing this for some time, but have you noticed a increase, a decrease, or has it always been a case where some students have anxiety, depression, emotional disorders?
I would say sadly that we're seeing a very large increase in the number of kids who have anxiety and depression, and I would say overall that what we're seeing are kids who are under much higher levels of stress and getting less sort of emotional support. A lot of support in terms of tutors and coaches and all of that kind of thing, but not necessarily as much support as we'd like to see in terms of their ability to manage the emotional stresses of all of this.
Wow.
And, yeah.
So what are some tips, I mean, it's that you would have for students and parents of students struggling with emotional disorders, want to overcome their challenges?
I think the first thing is to try to get as much information as you possibly can about what's going on. And I think a lot of times, particularly with adolescents, because there's so much moodiness that's completely normal in adolescence and so much emotional variability that's completely normal, that a lot of times parents will overlook significant signs of anxiety or depression, thinking, well, what do you expect? She's a 16-year-old adolescent girl. She's going to be upset. And I think that it's very important, if there are concerns about a child's behavior, changes in emotional presentation, to have that checked out and determine, is this just part of the sort of normal adolescent developmental process, or is there something going on like anxiety or depression? And so often when I have kids come in and go through an evaluation and we look at emotional functioning, and I have them often fill out questionnaires themselves, which I find adolescents seem to really prefer, at least before talking to me. A lot of times I'll have them fill out questionnaires about their feelings, and then I'll ask, would it be okay if I ask you some questions about some of these? And then typically we can have a good conversation about it. But often when I share with parents, your teenager said this, your teenager said that, she feels this way, they're often shocked. And they just say, wow, I had no idea that she was struggling so much, or I had no idea that she was so unhappy. And I think a lot of teenagers work very hard to kind of put on a good front and to try to get through things and not worry their parents, and they're just trying to be like everybody else, when really they can be in a tremendous amount of pain underneath all of that. So I guess the first tip would be to try to understand what's going on, and if there is a problem with anxiety or mood disorder, to get as much information as you possibly can about it, so that there's not usually one cure for these issues. It's usually multifaceted, so there's usually some lifestyle changes, maybe with regard to sleep or diet or exercise. There are things like yoga-based therapies that can be very helpful, or acupuncture, sometimes medication, and then learning cognitive strategies for how to manage different kinds of thoughts and feelings. So there's a lot to learn, and I think the more of an expert that the parent and the child can become on the disorder and what works for that kid the best, the better off they will be.
Nice. Now, when you were in high school, you worked with the brain, you learned about it, and you built a passion for it. Does what you enjoy about what you do today the same as what you enjoyed about it when you were a teen, or has it changed?
I think it's changed over time. When I was a teenager, I was really interested in kids who had very significant disabilities. The kids that I worked with were severely autistic, or the ones with cerebral palsy had cerebral palsy and significant intellectual disabilities. And I think at that time I was just really trying to understand what could happen that would cause somebody to have these kinds of disabilities. And I think over time that my interest has shifted more to kids whose disabilities are less severe, so kids who have learning issues, kids who have attentional issues, and emotional concerns. So there's been a bit of a shift over time.
Nice. And how can we get in touch with you and your services?
The easiest thing to do would be to give people the website address, which is www.nesca-newton.com, or if they just Google Nesca, and that shows how to contact everybody, and there's an intake form there if people are interested in having an appointment for a consultation or testing, and complete description of our services.
Okay, great. And can families outside of Massachusetts, New England area work with Nesca, or will you refer them to another
Absolutely, they can. In fact, we do a lot of work with international families. And
oh, fantastic.
Yep, coming from all over the world. And I actually do a fair amount of traveling myself to other locations internationally, and we have, just this month, I have one staff going to Connecticut to evaluate a child and another going to Colorado to evaluate a child.
Oh, nice.
So we can travel, or people can travel to us, and we work very hard to accommodate people's travel schedules. And when we have folks coming in from out of state or out of the United States, we have an expedited evaluation service where we can get the whole thing done in 2 or 3 days, because usually people can't be here forever. So
sure. Terrific. So to any teens listening to us today in our conversation, any one piece of advice before they cross that bridge to college and young adulthood?
I guess I'll give them 2 pieces of advice.
Oh, 2.
One is that as much self-awareness as they can develop, I think will be helpful. Mm-hmm. Really understanding what their strengths are and how they can develop those strengths, and understanding where their weaknesses are. overall in terms of their learning style, emotionally, socially. I think the more sort of self-awareness and self-acceptance the kids have as they move on to that next stage of independence, the better off they'll be. And the second thing that I always say to the young students that we train here is find a mentor. Find those people who are doing what you want to do or are interested in what you're interested in, and will take the time with you and help you to find your way. And I feel like that there's so many kids that I see going through college and graduate school that don't have good mentors, and I think it makes all the difference in the world so that people can make good decisions.
Great advice. So, Ann, thanks for coming on the Prepped and Polished podcast. Appreciate your time.
Oh, thank you. It was a pleasure.
And this wraps up our show today with Ann Helmus of NESCA. To learn more about the amazing work Ann does with students with learning disabilities and emotional issues, please go to www.nesca-newton.com. I'm going to spell that out. NESCA-NEWTON.com. For another related conversation, check out episode 52. It was my interview with Bonnie Singer of Architects for Learning, where Bonnie talks about how she helps students overcome challenges with their writing. And to access this podcast and all our podcasts, go to preppedandpolished.com/podcast to get all the podcasts. And make sure you be on the lookout for our next podcast episode, number 87. It'll be our next tutoring tips episode. Thank you for joining us on the Prepped and Polished podcast. Now go out there and take control of your education.
You've been listening to the Prepped and Polished podcast. For more information, check out preppedandpolished.com. Also, you can follow us on Facebook and Twitter. Thanks for listening. Class dismissed.